All right. Hello, everybody. My name is Alicia Chase. I'm the long-term care coordinator for Otsego County Office for the Aging and New York Connects. I am going to be doing a presentation today on Medicare basics. This is open enrollment time for Medicare beneficiaries, and during open enrollment, which runs October 15th through December 7th, you can make changes to your current Medicare plan. So it's a busy time here. I just want to take the time to go through this. This is being recorded and will be posted both to the Otsego County Office for the Aging and New York Connects Facebook page, as well as to our website at a later date. So as many of you, oops, hold on one second. Little technical difficulty there. Let me just get that PowerPoint back for us. Okay. So as many of you know, if you're already enrolled in Medicare, it's pretty complicated. It's pretty confusing. You get a lot of things in the mail. You get a lot of phone calls around the time of your 65th birthday, as well as during open enrollment. You see all kinds of commercials on the phone, TV. This could be free, that could be free. It could lower your costs. Some are true, some are half truths. So it's very confusing, and it's very important that you seek out help when determining that and get unbiased information. So today's goal is to talk about what is Medicare, who is eligible, what does Medicare cover, the original Medicare versus Medicare Advantage plans, and assistance paying for Medicare. So we're going to start off by what is Medicare? Medicare is the nationwide federal health insurance program of the Social Security Administration. For those of us who worked in the United States for 40 quarters or 10 years, we have been paying into Medicare. And when we are age 65, we become entitled to sign up for Medicare. And it's actually required that you do so, and we'll talk about that a little later. It's administered by the Center for Medicaid Services, known as CMS. Who is eligible for Medicare? So a U.S. citizen age 65 and older is eligible. A legal permanent resident 65 and older who have lived in the United States for at least 5 consecutive years. And a disabled person of any age as long as they have been disabled and receiving Social Security disability for 24 months, they become eligible. Someone with end-stage renal disease is also eligible for Medicare. And ALS, if you have Lou Gehrig's disease, you are eligible for Medicare. For most people, it's at age 65, and you are, as you can see here, here's your 65th birthday here in the middle in green. You can apply for Medicare the 3 months before your birthday, the month of your birthday, and the 3 months after your birthday. And you must enroll in Medicare Part A, even if you are still working. You must enroll in Medicare Part A during that 7-month window. If you're not still working at that time, you can also sign up for Medicare Part B, Medicare Part D, which is your drug plan, or you can look at an Advantage plan, which is Medicare Part C. They make it look here like you have to sign up for all 4, but that is not the case. If you signed up for Medicare Part C, you would nix the Medicare Part A and B, but we'll talk about that later. Your eligibility and enrollment when your employer coverage ends. So like I said, if you were still working at the age of 65, you would only have to enroll in Medicare Part A at that time. Medicare Part A is known as the free portion of Medicare. It's not really free. That while you were working, as I said, you used to pay into Medicare. And then you've paid for it in those 40 quarters. So Medicare Part A, you've already paid for while you were working. Medicare Part B in 2020 is $144.60. That does tend to go up a little bit each year. So when you separate from your employer, so if you were still working at age 65, when you separate from your employer, you will open what is known as a special enrollment period. The special enrollment period allows you to sign up for Part B and Part D within 63 days after your employer coverage ends. So if you left your position with your employer today, November 12th, and you would have 63 days from this date to sign up for Medicare Part B and Medicare Part D, assuming that your employer coverage ended on the same day of your separation today. To be eligible for enrollment in Part B, for people who do not enroll in Medicare, you have to enroll during your initial enrollment period, and your coverage would start on July 1st. If you don't enroll during your initial enrollment period when you are supposed to enroll, your coverage will not start until July 1st. So say you decided your birthday happened, you were still working, so you didn't take Part B, and then you separated from your employer in the month of November, but you still didn't take Part B, didn't take it in December, didn't take it in January, didn't take it all until February. In February, because you missed that enrollment period when you needed to do it within the 63 days, as I told you, you would not get your Part B coverage until July 1st. So you would be without coverage from that time through July 1st. Eligibility and enrollment Medicare for people with disabilities. After 24 months of being on Social Security disability, original Medicare A and B will begin on the first day of your 25th month. You will still need to enroll in a prescription drug coverage through Part D that can begin that month as well. Many times these individuals are on Medicaid, the state plan health insurance. They will require they will require that you sign up for Medicare, because the state plan, Medicaid, wants to be the payer of last resort. So if you are on Social Security disability and Medicare eligible, they will tell you that you have to sign up for Medicare. And with that, in order to continue with your Medicaid, you would need to choose a Part D plan. And if you didn't, they will auto enroll you in one, whether it's one that works with your prescriptions or it doesn't. So it's important that you take the initiative to look up those Part D plans and make sure that it's going to meet the needs of your prescriptions and your pharmacy. Medicare Part A covers hospital insurance if you are an inpatient in the hospital, and that's important. Because just because you go to the hospital, say you go to the emergency room and they say, oh, we're going to keep you overnight, we're not really sure what's happening, but we're going to admit you to the hospital. Make sure that you ask them, are they admitting you as an inpatient or are they admitting you under observation? So if they admit you as a hospital inpatient, then you would be covered by Medicare Part A. But if they admit you as an observation, then your Medicare Part A is not covering that stay, and it's your Medicare Part B. And it could cost you extra money. So it's important for you to know that. Medicare Part A is known as premium free for you as long as you have worked and paid FICA taxes for at least 10 years or 40 credits. If you had to buy your Part A, you would pay up to $458 each month for 2020. So if you didn't pay FICA taxes to get Medicare Part A, you would pay $458 each month just for Part A. If you don't buy it when you're first eligible for your monthly premium, that premium may go up by 10% for each month that you didn't take it when you were eligible around the 7 months of your 65th birthday, the 3 months before, the month of, and the 3 months after. Coverage for inpatient care in the hospital, it covers skilled nursing facility care. And by skilled nursing facility care, I don't mean if you needed to go live in the nursing home. That is a completely separate thing. It does cover skilled nursing facility care if you needed to go to rehab for a short time, not for a long permanent stay. It covers home health care and hospice care. So if you're admitted to the hospital and you need a home health aide or a skilled nurse at home, when you're discharged, Medicare Part A is what is paying for that. Here again, it says it does not include observation stay, as we mentioned, and that observation would be considered outpatient coverage. So your Part B would pick up, and then Medicare only covers 80%. So after that, your supplemental plan would be what is picking it up, or if you don't have a supplemental plan, it would be out of pocket. But when you are being covered under outpatient coverage, every test that you have costs a different amount. Every medication that they give you is paid separately, where if you're actually admitted as an inpatient, it's all inclusive under your Part A. Part A deductible is $1,408 per benefit period. A benefit period begins the day you are admitted as an inpatient in the hospital or a skilled nursing facility for rehab, and it ends when you have been out of the hospital for 60 consecutive days. So if you're admitted to the hospital today and you get out of the hospital on November 28th and you're home for a period of 21 days and you get readmitted to the hospital, that goes against that same benefit period. But if you go in the hospital on November 1st and you don't have any issues and you're not hospitalized again until March, then you would have a new benefit period, which would in turn have a new Part A deductible because you would have been out of the hospital for consecutive 60 days. Medicare Part B covers medical insurance. Part B premium is currently in 2020. It is $144.60. Part B covers preventative services. If you go to the doctor, your outpatient care, anything done outpatiently, any tests, home health care, durable medical equipment such as oxygen, and any mail order diabetic supplies. Those are all covered under your Part B. Your Part B has a deductible of $198 per year. And after your deductible is met, you typically only pay 20% of the Medicare approved amount. Your $144.60 is automatically taken out of your Social Security check each month. So if your Social Security check is $1,000 before Medicare, they would deduct the $144.60 and you would then see the deposit of the remaining amount in your checking account each month. Can you expect Part A and Part B to cover all costs? The answer is no. They do have deductibles, they do have copays, they do have coinsurances, and these are known as out-of-pocket costs. Typically, Medicare covers 80%, and the consumer is responsible for 20%. Medicare Part A and Part B does not cover prescriptions or over-the-counter drugs. It does not cover long-term care. It does not cover any dental, including dentures. It does not cover vision care. It does not cover any cosmetic surgery or acupuncture. It does not cover hearing aids and exams for fitting them or routine foot care. Covering out-of-pocket costs in original Medicare means that you need to have a supplemental plan. You need to get a Medigap plan that will help cover the deductibles, copays, and coinsurances. It also means that you need a prescription drug insurance known as a Part D so that you can pick up the costs that are not covered by the original Medicare A and B. Medicare supplemental plans, known as Medigaps, have a monthly premium. They help pay co-payments, co-insurances, and deductibles. These Medigap plans do not cover drugs. They do not cover any prescription drugs. The amount of how much is covered depends on the level of plan that you buy. There are plans A through G, A through N. So if you get an A plan, it's going to cover a lot less than an N plan. Levels are standardized by federal government. Secondary payers provider must bill Medicare first. No network restrictions follows Medicare. You must be enrolled in both Medicare A and B to be eligible for a Medigap plan. New York State has a continuous open enrollment for Medigap plans, and these are sold by private companies. Pre-existing condition wait periods may apply to a Medigap plan, and that wait period could be 6 months. So if you have a heart condition and you go to the doctor the month after you get a Medigap plan, that Medigap plan may not pay for that pre-existing heart condition for 6 months after. So these are the Medicare supplement insurance or Medigap plans. So as you see here, a Part A plan will cover your Medicare Part A co-insurance and hospital costs. It will cover your Medicare Part B co-insurance and copayment. It will cover blood for the first 3 pints and Part A hospice care, but it will not cover any of the skilled nursing facility care, Part A deductible, Part B deductible, Part B excess charges, or foreign travel. But if you go over here to a Part N plan, you'll see here that Part F covers everything. Part F is no longer available as of 2020 to new enrollees. If you already have a Part F, you could stay with that. But if you don't have a Plan F currently, it is not going to be available to you as a new person coming into the Medicare system. So a Part N covers a little bit better than this Part A, as you can see here. It does not cover Part B deductibles or Part B excess charges. A Part G covers almost everything that the Plan F would have covered, but it does not cover your Part B deductibles. And that's the only difference in a Plan G over a Plan F. So if you were looking for the best plan at this time, it's going to be a Plan G. And it's a little small, but as you can see, these are not all inclusive. So this just shows you some standardized Medicare supplemental premiums as of June 1st, 2020. And there could be more, there could be less, there could be different ones for 2021. But everything that you see here under a Plan N, you'll see that the lowest cost one here is with United Healthcare AARP for a Plan A at $136.50. And the most expensive one here is with Bankers Conseco at $253.94. So it doesn't mean that because you pay more money, you're getting a better plan. With a Plan A, every single one of those companies has to offer at least the minimum of what you saw on the previous chart. They have to cover at least this. So just because you pay the more expensive amount doesn't mean that you're going to get a better insurance. A Plan A is a Plan A. So over here under a Plan G, it's the same kind of situation. So you can get Transamerica Financial if that works with your medical provider, which is the important thing that you want to make sure that your doctor accepts this insurance. Transamerica Financial, is $199 each month, where you can get Bankers Conseco for $412 each month. But again, they cover the same thing. A Plan G has to cover, all Plan Gs have to cover at least the same amount that we saw on this chart back here. Prescription drug coverage, a Part D, is sold by private companies. They are region specific. So when you look up your Part D coverage, if you put in 13326 as your zip code for Cooperstown, New York, your prescription drug coverage will be different than somebody putting in their zip code for even Herkimer County or Westchester County. It is region specific. So it is important that if you're going to travel, that you make sure that your insurances that you are selecting not only cover the region of which you live in, but any region that you would regularly travel to. Enrollment is allowed during the initial enrollment period and special enrollment periods. You can apply online to switch plans yearly, and that yearly time is from October 15th to December 7th. That is open enrollment every year. Monthly premiums for prescription drug plans range anywhere from $13.20 to $91.20. The deductibles can range anywhere from $0 to $435, and those are usually annual deductibles. Different plans cover different medications, different pharmacies charge different prices, but all for the same medications. So it's important to go to someone who can help you do the research. Each year, plans can change their structure, so they can change what they are going to cover, what their deductibles are, what pharmacies they're going to allow, what's going to be in-network and out-of-network, what are going to have higher copays and lower copays. They can do that. They can make that change each year. And it's important to verify your coverage each year during open enrollment, even if you don't make a change. It's important to be aware of the late enrollment penalty. This may incur 1% penalty for each month of delay. So it's the same kind of thing. You have to take Part D when you are eligible for Part D, which is either at the time that you take your plan, Part A, or at the time that you separate from your employer coverage. You can use Plan Finder on Medicare.gov to help you find the best coverage for your medications. And in there, you would put your zip code, so the region of which you live. You would list all of your medications, their frequency and their dosing, and then your pharmacy. And it will bring up all of the plans that are available to you, as well as what your total out-of-pocket annual costs would be and what your per month out-of-pocket costs would be. So here's a quick summary of Original Medicare. It's a primary insurance, Parts A and B. If you decide on a supplemental plan, you'll have an additional card. Both cards accepted by a participating medical provider. If you purchase a Part D, you're going to have a third card. Local High Cap has information on Parts D and supplemental insurance plans. And by local High Cap, so here in Otsego County, you can reach out to Otsego County Office for the Aging. They have trained high cap counselors. If you are under the age of 60, you're still going to call Office for the Aging, but you're going to get a New York Connects counselor. They will be able to assist you in looking up a Part D or a supplemental insurance plan. You can also call the statewide Senior Action Council, and you can call Medicare themselves, and those numbers will be available at the end of the slide. If you choose alternative Advantage plans, otherwise known as Part C, which is why I said it was a little confusing in the slides before, is in a Medicare Advantage plan, you have to have Medicare Parts A and B to join an Advantage plan. You have to live within the plan service area. They are sold by private companies that provide the Medicare Part A and Part B benefits, and some Medicare Advantage plans also provide Part D. You'll get one card for all of that, where in the previous slide I said you would have 3 cards. So you'd have Medicare Part A and B, you would have a supplemental or a Medigap plan, and you would have a prescription drug plan. So you would have 3 cards for your coverage. With a Medicare Advantage plan, it's possible that you just have 1 card. It's regulated by federal government. It involves a cost share for services. It involves co-pays. It uses a network of providers and does not move with you. Some require a referral to see a specialist. Some may include extra benefits such as vision or dental. And most have a monthly premium. You will see on TV, especially this time of year, you see like plans offering $0 premiums. You're still going to have to pay that $144.60 that's automatically deducted from your Social Security, no matter if it says $0 premium. It just means that you have a $0 premium for the additional that in a Medigap plan might be costing you $215. You could have an Advantage plan that's only going to cost you the $144.60. That is the 2020 rate for Medicare. However, it's important to note the out-of-pocket costs that you're going to have with an Advantage plan, because you will have copays and you will have deductibles. Those could add up depending on how many times you go to the doctor. Those could add up to more than what you would pay for your premium of a Medigap plan. You can have an HMO for a Part C. You can have a PPO for a Part C. You can have a private fee for service. HMO plans require that beneficiaries see healthcare providers, doctors, and hospitals within that plan's network, except in an emergent situation. Some plans are known as HMO point of service plans. Beneficiaries may be able to go out of network for certain services, but may have to pay a higher cost. And this is where the extra out-of-pocket costs may be more than what you would pay for just traditional Medicare with a Medigap plan. So these are all things to be cognizant of as you're choosing your Medicare services. Some of the HMOs require that you have a specific primary care physician. A PPO plan does not require that you use in-network providers, and you do not have to require a referral to see a specialist. In most cases, they do not require that beneficiaries choose a primary physician, so you could go to any physician you choose. In a PFFS, or a private fee for service, you can see any one of the network providers who have agreed to always treat plan members. You can also choose an out-of-network doctor, hospital, or other provider who accepts the plan's terms, but your costs will usually be lower if you stay in-network. To choose these plans, both Medigap plans and Advantage plans, you can use the Plan Finder on Medicare.gov. Retiree options. So retiree plans may work with Medicare. You have to be enrolled in Medicare's Part A and Part B to access your retiree benefits. And you want to ask your employer, your HR, or your payroll specialist how your retiree plan works with Medicare. Some retiree plans offer Medicare Advantage plans as an option, and some may function like a Medigap or a supplement where you have Medicare Part A and Part B, and then they pick up that 20% difference as a Medigap or a supplement. Some also include creditable drug coverage, so you wouldn't need the Part D coverage through Medicare. So it's important to check with your employer, either your HR department or your payroll specialist, to find out what your particular retiree plan options are available to you. You are able to change your plan coverage. You can do it annually during your election period or open enrollment, which is, as I said, October 15th to December 7th every year. annual Medicare Advantage open enrollment, initial open enrollment, and an additional special enrollment. So if you, during open enrollment, October 15th to December 7th, chose a plan and then you decided, I don't know that I want to do this when it becomes effective on January 1st, between January 1st and March 31st, you have kind of like a get out of jail free period where you can switch back. You can switch from one Medicare Advantage plan to another Medicare Advantage plan, or you can go from a Medicare Advantage plan to original Medicare. And that's your Medicare Advantage open enrollment period, which is January 1st to March 31st. The annual election period or open enrollment period is October 15th to December 7th, and that plan coverage is effective January 1st of the new year. Initial enrollment periods, if you initially enrolled in Medicare Advantage plan, you may change back to your original Medicare within 12 months of the initial enrollment. There are special enrollment periods if you change jobs, retire, if you become ill and you can't work anymore and you're disabled. There are many special enrollment periods, and you'd have to see a HICAP counselor for more details on your situation. You should review your coverage each year for the 3 C's: convenience, the network, and the preferred pharmacies. Do they offer mail order? Coverage, all plans have different formularies and different coverage. And cost, know all possible costs. Sometimes you'll get a notice from your plan that they are going to raise your rates or they're not going to accept your pharmacy anymore. But sometimes you don't know anything, but there may be a cheaper plan out there for you. So if you go to medicare.gov and plan finder during open enrollment, you could look and see if there's something that's cheaper that you didn't know about and you wouldn't know about unless you look that up. There are some state plans that allow you to get assistance in covering the cost of some of these out-of-pocket expenses. Extra Help and State Pharmaceutical Assistance Program, SPAP, assist individuals. You must have a Part D plan to qualify. It may lower your copays at pharmacies. It may cover your Part B premiums, and it's a secondary payer. Epic allows you to have an income of $75,000 for a single person or $100,000 for a married couple. Approval and level of assistance is based on income, and once a year, it allows you a special enrollment period. You should contact one of the SHIP counselors for details, and a SHIP counselor can be found at Statewide Senior Action Council by calling 1-800-MEDICARE or by reaching out to your Otsego County Office for the Aging. Extra Help is a program for Part D. It provides reduced or no premiums. It provides reduced or no deductibles. It can help with no more than 15% copays. A person must be receiving Medicare, have a limited resources and income, reside in one of the 50 states or the District of Columbia. Extra Help income limits for incomes less than $1,425 per month and resources up to $9,230 for a single person, or for a married couple with income of $1,922 per month or resources up to $14,600. You have to be living with your spouse and have no other dependents. If you qualify for the Medicare Savings Program, you automatically qualify for Extra Help, and there is no need to look at assets. The Medicare Savings Program is help from the state to pay your Medicare premiums. In 2020, the income eligibility for a single person is $1,426 per month. For a married couple is $1,923 per month. It gives the added benefits as it pays your Part B premiums. It lowers the cost of prescriptions at pharmacies, and it takes away any penalties that you may have incurred if you did not sign up for a Medicare prescription drug plan when you were eligible. Individuals making less than $875 per month could qualify for Medicaid in addition to your Medicare. Medicare would be your first payer, and Medicaid would be the payer of last resort. With Medicaid for a single person, your resources have to be less than $15,750. For a couple, you can have an income of $1,284. That's a combined total. And your resources have to be less than $23,100. It automatically enrolls you in extra help. It lowers the cost of copays for medications. It covers Medicare Part D premiums. It makes you auto-enrolled in a Part D, which is where I had mentioned earlier. It's important for you to, they do give you a window where you are able to select your own Part D before being auto-enrolled. If you're auto-enrolled, it's just kind of like a rotating cycle. So you just go into whatever is the next plan that they have in their rotating schedule. It doesn't mean that it's a plan that's going to work with your medications. It doesn't mean that it's a plan that's going to work with your pharmacy. So it's important that you yourself take the initiative to look up a Part D plan that's going to work with your pharmacy and your prescriptions. Medicaid is a secondary insurance. It covers what Medicare does not cover. It adds coverage such as dental, hearing, and eyes. If you had Medicaid prior to age 65, it's important for you to know that at age 65, that might be different for you. Medicaid prior to age 65 has higher income allowances than it does after age 65 when you become dual eligible as a Medicare beneficiary as well. So in summary, option 1, you have original Medicare, A and B, secondary insurance, a Medigap or Medicaid, and a prescription drug coverage. That would get you fully covered. Option 2, you have a Medicare Advantage plan, Part C, that covers hospitalization, medical, and prescription drug coverage. So option 2 typically gives you 1 card, where option 1 typically gives you 3 cards. How to prevent fraud and abuse. Do not give your Medicare number except to your doctor or other Medicare provider. Review your Medicare summary notices for services not received, for double billing, for services not ordered by your doctor. Access your personal Medicare information at www.mymedicare.gov, and you can sign up for that when you're enrolling at medicare.gov. Be aware that Medicare does not call or visit to sell you anything. Treat your Medicare card like a credit card. Do not give it to anybody. Watch out for identity theft. Office for the Aging has another a presentation on our Facebook page and soon to be on our website for scams. And there are many scams out there targeting seniors, including ones that use senior social security numbers. They present themselves as Social Security. It's important for you to be informed of that stuff as well. So I would urge all of you to watch that video. Call the provider, gather information and documentation. Contact the Senior Medicare Patrol. And then here's the websites and phone numbers. If you feel like someone is presenting as someone that they're not and they want your information, report them. That's the only way we're going to catch them. As I mentioned before, you can also contact the New York Statewide Senior Action Council. They can do the same Medicare counseling that we can do here at Office for the Aging, as can Medicare Rights Center at 1-800-MEDICARE. And these contacts are listed here for you. I'll leave it up for just a second so you can write them down if you would like to. And that concludes our program today. This program will be posted on November 18th for your viewing. And to reach Otsego County Office for the Aging, you can give us a call, 607-547-4232. Thank you and have a great day.